Question 1. A nurse is preparing to administer a medication and notices the dose is double the usual prescribed amount. What should the nurse do? A. Administer the medication as ordered. B. Contact the pharmacy for clarification. C. Verify the order with the prescribing provider. D. Ask a colleague if the dose looks appropriate. Answer. C. Verify the order with the prescribing provider. Rationale. A double dose may indicate a prescribing error. The nurse must clarify any unusual or potentially unsafe orders with the provider to prevent harm. Administering the drug or asking a colleague is unsafe without verification. Question 2. A patient prescribed warfarin reports eating large amounts of spinach daily. What is the nurse's priority action? A. Document the dietary habit. B. Notify the provider. C. Teach the patient to avoid all green vegetables. D. Hold the medication. Answer. B. Notify the provider. Rationale. Spinach is high in vitamin K, which can reduce the effectiveness of warfarin. The provider may need to adjust the dose. Educating the patient is important, but immediate provider notification is the priority. Question 3. Before administering insulin, which action is most important to prevent hypoglycemia? A. Check the patient's weight. B. Assess for signs of infection. C. Confirm that the patient has eaten. D. Ensure the insulin is room temperature. Answer. C. Confirm that the patient has eaten. Rationale. Administering insulin without food intake can lead to hypoglycemia. Ensuring a recent meal helps prevent this complication. Question 4. Which of the following actions demonstrates safe medication administration for a pediatric patient? A. Estimating the dose based on the child's appearance. B. Using an adult dose if the pediatric dose is unclear. C. Calculating the dose based on weight in kilograms. D. Rounding up doses to simplify administration. Answer. C. Calculating the dose based on weight in kilograms. Rationale. Pediatric dosing is weight-based to ensure safety. Using adult doses or estimating increases the risk of overdose. Question 5. A nurse is administering a high-alert medication. What is the most appropriate action? A. Administer quickly to avoid delays. B. Have another nurse independently verify the dose. C. Rely on the MAR for verification. D. Skip verification if the patient has taken it before. Answer. B. Have another nurse independently verify the dose. Rationale. High-alert medications pose serious risks. Double-checking with another nurse reduces the chance of a serious error. Question 6. A nurse notices a medication has expired. What is the correct action? A. Administer it since it's only a few days expired. B. Notify the charge nurse and return it to pharmacy. C. Document it was given late. D. Relabel the medication with a new date. Answer. B. Notify the charge nurse and return it to pharmacy. Rationale. Expired medications must not be administered. They should be reported and removed from circulation. Question 7. What is the best method to ensure the correct patient receives a medication? A. Ask the patient to confirm their medication. B. Check the patient's chart at bedside. C. Scan the patient's wristband and verify with MarchD. Ask the patient's roommate for their identity. Answer. C. Scan the patient's wristband and verify with March Rationale. Barcode scanning and MAR verification are reliable safeguards against wrong patient errors. Question 8. A nurse gives informed medication too rapidly, and the patient experiences side effects. What is the nurse's next step? A. Ignore it if the patient recovers quickly. B. Document the incident without reporting. C. Report the medication error per policy. D. Adjust the rate next time and move on. Answer. C. Report the medication error per policy. Rationale. All medication errors must be reported to promote safety and system improvement. Ignoring or hiding it is unethical. Question 9. Which action violates safe medication administration? A. Crushing an enteric-coated tablet. B. Verifying allergies before administration. C. Checking the expiration date. D. Comparing the label to the March answer. A. Crushing an enteric-coated tablet. Rationale. Enteric-coated tablets are designed to resist stomach acid. Crushing them destroys this protection and can cause harm. Question 10. When should a nurse perform hand hygiene during medication administration? A. Only after giving injections. B. Before and after all medication handling. C. After opening oral medication packages. D. Only when visible contamination is present. Answer. B. Before and after all medication handling. Rationale. Hand hygiene before and after handling any medications helps prevent cross-contamination and infection. Question 11. A patient refuses a prescribed medication. What is the nurse's best initial action? A. Document the refusal and discard the dose. B. Insist the patient must take the medication. C. Explore the reason for refusal with the patient. D. Hide the pill in food to ensure it is taken. Answer. C. Explore the reason for refusal with the patient. Rationale. Understanding the patient's concerns promotes autonomy and helps address issues, preventing compliance. Question 12. What should the nurse do before giving a newly prescribed antibiotic? A. Obtain a urine sample. B. Check the patient's temperature. C. Confirm that cultures were drawn. D. Administer with a full glass of water. Answer. C. Confirm that cultures were drawn. Rationale. Cultures should be obtained before the first antibiotic dose to ensure accurate results for identifying pathogens. Question 13. Which medication would require the nurse to assess apical pulse before administration? A. Furosemide. B. Digoxin. C. Acetaminophen. D. Metformin. Answer. B. Digoxin. Rationale. Digoxin slows the heart rate and should only be given if the apical pulse is within safe range, e.g., greater than 60 bpm in adults. Question 14. A nurse is reviewing a patient's MAR and notices a medication is ordered for a route the patient cannot tolerate. What is the best action? A. Skip the dose. B. Substitute with a similar drug. C. Call the provider for a route change. D. Crush the pill and give with applesauce. Answer. C. Call the provider for a route change. Rationale. The nurse must advocate for the patient by contacting the provider when a prescribed route is inappropriate. Question 15. What is the nurse's priority before administering potassium for? A. Ensure the patient has urinated. B. Assess bowel sounds. C. Check glucose level. D. Ask about numbness. Answer. A. Ensure the patient has urinated. Rationale. Potassium can accumulate in renal impairment. Urine output must be confirmed to avoid dangerous hyperkalemia. Question 16. A nurse administers the wrong medication. What is the first action the nurse should take? A. Notify the provider. B. Check the patient's condition. C. Complete an incident report. D. Report to the nurse manager. Answer. B. Check the patient's condition. Rationale. The nurse must assess the patient first to identify any immediate adverse effects and ensure safety. Question 17. Which instruction should the nurse give a patient taking tetracycline? A. Take with dairy for better absorption. B. Avoid sunlight exposure. C. Stop if experiencing GI upset. D. Take with antacids for stomach protection. Answer. B. Avoid sunlight exposure. Rationale. Tetracycline can cause photosensitivity. Patients should be instructed to avoid direct sun and use protection. Question 18. What is the most appropriate action when a patient questions a medication's purpose? A. Reassure them it is correct. B. Encourage them to ask the provider. C. Recheck the order and provide education. D. Tell them not to worry. Answer. C. Recheck the order and provide education. Rationale. The nurse should confirm the prescription and explain it clearly to promote trust and informed consent. Question 19. A nurse is preparing a narcotic for administration. What safety measure is essential? A. Dispose of the empty vial in regular trash. B. Document it after shift ends. C. Count controlled substances with another nurse. D. Store it in the medication room. Answer. C. Count controlled substances with another nurse. Rationale. Narcotics require strict documentation and must be counted with a witness to prevent diversion. Question 20. What is the safest way to prevent medication errors when giving multiple medications? A. Administer all medications at once. B. Group similar-looking pills together. C. Give medications one at a time and label clearly. D. Pre-pour medications for multiple patients. Answer. C. Give medications one at a time and label clearly. Rationale. Giving meds one at a time with clear labels helps prevent confusion and reduces risk of administering the wrong drug. Question 21. A nurse is preparing to administer a medication via nasogastric NG tube. What should the nurse do first? A. Dilute the medication with orange juice. B. Flush the tube with sterile water. C. Verify tube placement. D. Mix medications together. Answer. C. Verify tube placement. Rationale. Verifying NG tube placement ensures the medication goes into the stomach and not the lungs, preventing aspiration. Question 22. Which of the following is a high-alert medication that requires double-checking before administration? A. Ibuprofen. B. Heparin. C. Diphenhydramine. D. Furosemide. Answer. B. Heparin. Rationale. Heparin is a high-alert medication due to its narrow therapeutic range and risk of bleeding, so independent double checks are required. Question 23. A nurse is giving a newly prescribed medication and the patient reports an allergy to it. What is the best action? A. Hold the dose and notify the provider. B. Administer a smaller dose. C. Give it and monitor for reaction. D. Document the allergy in the chart. Answer. A. Hold the dose and notify the provider. Rationale. Suspected allergies must be treated as true until evaluated by the provider. Administering the drug could cause harm. Question 24. A patient questions why they are receiving a lower dose of a drug than yesterday. What should the nurse do? A. Tell them not to worry. B. Recheck the medication order. C. Call the pharmacy. D. Assume the physician made a change. Answer. B. Recheck the medication order. Rationale. Verification ensures accuracy and allows the nurse to detect any potential prescribing or transcription errors. Question 25. A nurse is teaching a patient about sublingual nitroglycerin. Which statement indicates proper understanding? A. I should swallow the pill whole. B. I should chew the tablet. C. I should place it under my tongue to dissolve. D. I should take it with water. Answer. C. I should place it under my tongue to dissolve. Rationale. Sublingual medications are absorbed through mucosa for quick effect. They should not be swallowed or chewed. Question 26. When a medication label is hard to read or damaged, what should the nurse do? A. Guess based on past experience. B. Use a different vial of the same drug. C. Give it anyway if the name is recognizable. D. Discard it and request a new dose. Answer. D. Discard it and request a new dose. Rationale. Using a label that is unreadable risks giving the wrong drug or dose. A new, clearly labeled dose is safest. Question 27. A patient receiving gentamicin 4 is ordered peak and trough levels. When should the nurse draw the trough level? A. 30 minutes after the dose. B. Immediately after the dose. C. Just before the next dose. D. 2 hours after the dose. Answer. C. Just before the next dose. Rationale. Trough levels are drawn just before the next dose to assess the lowest concentration in the blood for toxicity risk. Question 28. Which statement indicates that a patient understands their new opioid prescription? A. I can drive as long as I feel okay. B. I should avoid alcohol while taking this medication. C. I'll stop it if I feel any pain. D. I can take more if I'm still hurting. Answer. B. I should avoid alcohol while taking this medication. Rationale. Opioids and alcohol can cause respiratory depression. Combining them is dangerous. Question 29. What action should the nurse take when a patient is scheduled for surgery and has just received an oral medication? A. Cancel surgery. B. Notify the provider. C. Induce vomiting. D. Proceed as planned. Answer. B. Notify the provider. Rationale. The surgeon or anesthesia team must know what medications were administered to assess risk and adjust plans. Question 30. A nurse receives a verbal order for a medication. What must be done before administration? A. Document the time and give the medication. B. Have a second nurse confirm the order. C. Read back the order to the provider for confirmation. D. Skip documentation until after administration. Answer. C. Read back the order to the provider for confirmation. Rationale. Reading back the order prevents miscommunication errors and ensures accuracy. Question 31. A nurse notes that a medication prescribed to a patient is no longer on the hospital formulary. What is the best action? A. Substitute a similar drug. B. Omit the dose. C. Call the provider for an alternative. D. Ask the pharmacist for permission to change it. Answer. C. Call the provider for an alternative. Rationale. Only the provider can legally change a medication order. The nurse must communicate the issue to obtain a substitute. Question 32. A patient has a feeding tube and a crushed extended-release tablet is ordered. What should the nurse do? A. Crush and give through the tube. B. Give it orally instead. C. Consult pharmacy for an alternative. D. Administer it with food. Answer. C. Consult pharmacy for an alternative. Rationale. Extended-release medications should never be crushed. Pharmacy can recommend a safe form. Question 33. A nurse is administering insulin to a patient. Which site is most appropriate for a rapid absorption? A. Thigh. B. Buttocks. C. Abdomen. D. Upper arm. Answer. C. Abdomen. Rationale. The abdomen provides the fastest absorption for insulin due to its vascular supply. Question 34. What should a nurse include in discharge teaching about antibiotics? A. Stop taking once you feel better. B. Skip doses if nausea occurs. C. Take the full course as prescribed. D. Save extra pills for future use. Answer. C. Take the full course as prescribed. Rationale. Completing the full course prevents resistance and ensures full infection resolution. Question 35. Which lab value should be checked before administering enoxaparin? A. Platelet count. B. Hemoglobin A1C. C. Sodium level. D. Creatinine clearance. Answer. A. Platelet count. Rationale. Enoxaparin can cause thrombocytopenia. Platelet monitoring helps detect this early. Question 36. The provider orders 2 milliliters of medication to be given IM to a 2-year-old. What is the best site? A. Deltoid. B. Dorsogluteal. C. Ventrogluteal. D. Abdomen. Answer: C. Ventrogluteal. Rationale: the ventrogluteal site is safest for IM injections in young children due to low risk of nerve injury. Question 37. A nurse is administering morphine and notices the patient has a respiratory rate of 8. What should the nurse do? A. Give the dose slowly. B. Hold the medication and notify the provider. C. Administer naloxone. D. Raise the head of the bed and continue. Answer: B. Hold the medication and notify the provider. Rationale: a respiratory rate under 12 is a concern for opioid-induced depression. Hold and report before taking further action. Question 38. When administering eye drops, what technique ensures correct delivery? A. Apply drops directly to the pupil. B. Touch the dropper to the conjunctiva. C. Drop medication into the lower conjunctival sac. D. Blink repeatedly after application. Answer: C. Drop medication into the lower conjunctival sac. Rationale: this avoids injury and ensures proper absorption without contamination. Question 39. A nurse is preparing to give oral medications to a confused patient. What is the best strategy? A. Leave the meds at the bedside. B. Confirm identity and watch the patient swallow. C. Mix with food without telling the patient. D. Ask a family member to give them. Answer: B. Confirm identity and watch the patient swallow. Rationale: direct observation ensures the medication is taken safely and helps prevent hoarding or misuse. Question 40. A nurse is giving 4 potassium chloride. Which safety step is essential? A. Push it rapidly for quick correction. B. Mix it with calcium gluconate. C. Dilute and infuse it slowly via 4 pump. D. Administer via intramuscular route. Answer: C. Dilute and infuse it slowly via 4 pump. Rationale: for potassium must be diluted and infused slowly to prevent cardiac arrest. Never push potassium. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.